When I was growing up, my grandfather lived next door to us. He had a very profound hearing loss. I always wanted to spend time with him and talk to him and connect with him, but it was really hard to communicate with him. Not wanting to get help is very common for people with hearing loss, especially as they get older and they start to think that hearing loss is just part of getting older, and they want to withdraw, they don't want to communicate. It's hard to accept the fact that you have limitations and you do need help, and it's a big step for people to get the help they need. I'm definitely cognizant of that, trying really hard to kind of break down any of the negative associations of hearing aids or treating your hearing loss. We try to tell people that having a hearing loss and struggling to understand speech is much more obvious than a hearing aid, which is actually much, much smaller than it used to be and practically invisible for some people. I guide a patient in the way of just trying to help them understand, first of all, what their condition is, what their hearing loss is, what types of things they may be missing with their hearing loss, explaining what the treatment process is, kind of helping them figure out what the best treatment option is for them, and then kind of going from there in terms of picking the right type of hearing aid, and then showing them everything they would possibly need to know to be able to use the hearing aids effectively on their own. The way I differentiate for pediatric patients is just trying to make them feel comfortable, making them kind of feel like it's a game. So they're going into the booth saying, we're going to play a listening game, listen for the birdies, making sure they feel like it's supposed to be fun. One of the most rewarding cases I've had was having a patient in the office who had a very severe hearing loss just in one ear and normal hearing in the other ear. We were demoing a type of system that helps people with hearing loss just on one side. You have a microphone on the bad ear and then a hearing aid on the good ear. And all the sounds from the bad side get wirelessly sent over to the good side. So for example, if someone's sitting on your bad side and they're speaking into that side, they'll be kind of hearing all those sounds on the bad side on their good side. It's a way of getting the awareness of sound that you wouldn't otherwise have with such a severe hearing loss on one side. So we were demoing that system, and she was able to hear on the bad side to a certain degree, and it made her cry. She was very emotional. Right away, she was saying, I need to have this, I need to get this, and got her the system, and it was life-changing for her to be able to get sound awareness on that bad side. I really love being able to see the difference it makes when you put hearing aids on, even just as a demo for a few minutes, and seeing people engage more, having them just hear sounds they've never heard before, like footsteps or water rushing or things like that. Being able to have people hear those sounds and just realize what they've been missing is really valuable.